Question. A 65-year-old male presents to the emergency department with sudden onset chest pain radiating to his back. He is hypertensive, tachycardic, and diaphoretic. A chest X-ray shows a widened mediastinum. What is the most likely diagnosis? A. Acute myocardial infarction. B. Pulmonary embolism. C. Aortic dissection. D. Tension pneumothorax. Correct answer is C. Aortic dissection. Aortic dissection. Key symptoms. Sudden, severe chest pain radiating to the back, often described as tearing or ripping. Risk factors. Hypertension, older age, connective tissue disorders, e.g., Marfan syndrome. Chest X-ray findings, widened mediastinum due to the dissection of the aortic wall. Other options. Acute myocardial infarction. Presence with chest pain but usually lacks the radiating back pain and widened mediastinum. Pulmonary embolism, features pleuritic chest pain, shortness of breath, and tachycardia, may show a normal chest X-ray or signs of infarction. Tension pneumothorax, causes unilateral decreased breath sounds and tracheal deviation, no widened mediastinum. Immediate diagnosis is critical, as aortic dissection is a life-threatening emergency requiring urgent imaging, e.g., CT angiography, and management.